Have you ever felt like your bladder just has a mind of its own? Well, today we're going to demystify a really powerful medical test called urodynamics. We're going to break down what it is, exactly how it works, and what it can tell your doctor about your bladder's unique story. For a lot of people, it all starts with a question just like this one. Maybe you're dealing with leakage, or that constant nagging urge to go, or you just feel like you can't empty all the way. When a normal physical exam doesn't really give a clear answer, doctors need a way to look deeper, to really understand the function of your lower urinary tract.
And that is exactly where urodynamics comes in. Think of it as the ultimate diagnostic tool. It lets doctors move past just the symptoms to get right to the root cause of the problem. It gives them the hard data they need to paint a really clear picture of what's actually going on.
So at its heart, urodynamics is kind of like a complete performance review for your bladder. The whole test really zeroes in on its two main jobs, storing urine, and then, of course, emptying that urine. It's an interactive study, which means it's measuring exactly how your bladder and urethra are working together in real time.
The entire test really boils down to these two fundamental parts. First, you've got the storage, or filling phase. This is where we see how your bladder behaves as it fills up. And then, second, you have the emptying or voiding phase, where we analyze just how efficiently it lets all that urine go. If you can keep this two-part structure in your head, the whole process makes a lot more sense.
Okay, let's dive into the first half, the storage phase. This part is all about checking your bladder's ability to act as a good, reliable, low-pressure container for urine. And to do this, doctors use a test called cystometry. What it does is measure the relationship between pressure and volume in your bladder. So in simple terms, it tracks how the pressure inside changes as your bladder is slowly and gently filled with sterile fluid through a tiny little catheter.
Now, during this filling process, doctors are looking for 4 key pieces of the puzzle. First, sensation. When do you first feel that you need to go? Then, capacity. What's the maximum amount your bladder can comfortably hold? Third is compliance. How well does that bladder wall stretch? And finally, are there any of those pesky involuntary contractions, bladder spasms, that really shouldn't be happening?
Let's focus on compliance for a second, because it is one of the most important things they measure. A healthy bladder is like a brand new, stretchy balloon. You can fill it with a lot of volume without the pressure going up much at all. But a poorly compliant bladder, that's more like an old, stiff balloon. The pressure builds up way too quickly, and over time, that can actually be pretty dangerous for your kidneys.
And what's so fascinating is you can see exactly what this looks like on a urodynamics reading. Take a look at that bottom line, the one labeled PDEET. That stands for detrusor pressure. That's the pressure from the bladder muscle itself. See that steady, steep climb? That is the classic, textbook sign of poor compliance. It's a red flag that the bladder is storing urine at an unsafe pressure. Now, the other major thing they're looking for during the storage phase is something called detrusor overactivity. These are those unwanted, involuntary bladder squeezes or spasms that can happen while the bladder is supposed to be relaxing and filling. For a lot of people, these contractions are the direct cause of that sudden, gotta go now feeling that can lead to leakage.
And this chart just illustrates it perfectly. Again, look at that bottom line for detrusor pressure. Those sharp, sudden spikes, right where the arrows are pointing, those are the involuntary contractions. Your bladder should be calm and quiet while it's filling. So these spikes are a clear, objective sign that matches up with a patient's symptoms of urgency.
All right, on to the second phase, emptying. So once the bladder is full, the whole focus of the test shifts from how it stores urine to how effectively it voids it.
And this part often kicks off with a really simple, non-invasive test called uroflowmetry. All you have to do is urinate into a special toilet or a funnel that has a sensor in it. This machine measures everything: how much you voided, your flow rate, how long it takes, and it gives a fantastic first look at how well your bladder is emptying.
The really crucial thing to look at here is the shape of the graph that this test creates. A healthy, unobstructed urinary stream makes this classic, smooth, bell-shaped curve. See how the flow rate quickly shoots up to a peak and then just as smoothly falls back down to zero? That's what you want to see.
This side-by-side comparison just makes the difference crystal clear. Up top, you've got that nice, healthy bell shape. But then look at the bottom graph. The flow is all flattened out and it's prolonged. This plateau shape is an immediate clue that the urine stream is really struggling to get out, like it's fighting against some kind of blockage.
Now, to absolutely confirm there's an obstruction, doctors will do what's called a pressure flow study. They measure the bladder pressure while you're urinating and then plot it against the flow rate. For men, they use charts like this one, called nomograms. If you've got a high bladder pressure but a low flow rate, well, you land right in that obstructed zone, and that gives a definitive diagnosis.
But what if the picture still isn't totally clear? Well, for more complex cases, doctors can bring in some advanced tools to add more layers of detail to the story. One of those tools is electromyography, or EMG. This usually involves placing a few small sensor patches to measure the electrical activity in your sphincter muscles. They use it to see if the sphincter is relaxing at the right time to let urine pass. As you can see in this little diagram, when the command to void is given, that EMG activity should go quiet. That signals relaxation.
And for the most complex cases of all, there's video urodynamics. This is the whole shebang. It combines all the pressure and flow measurements with a simultaneous X-ray video. This gives doctors a real-time movie of the bladder and urethra as they fill and empty, letting them see the actual anatomy in action and pinpoint the exact location of a problem, like a blockage or reflux.
So, after all these graphs and pressures and images have been collected, how does it all come together? Well, the real power of urodynamics is in translating all that raw data into a specific, actionable diagnosis.
And this table here just connects the dots perfectly. If the test shows leakage when you cough or bear down, that points directly to stress incontinence. High pressure with a low flow rate, that confirms a bladder obstruction. And those involuntary contractions we saw earlier on the graph, that's the hallmark sign of an overactive bladder. High-pressure storage with poor compliance is a key indicator of a neurogenic bladder that needs to be managed carefully.
So after all this, what's the most important thing to take away? What is the ultimate purpose of creating this incredibly detailed picture of your bladder's function? It all comes down to this. The entire goal of urodynamics is to take what you're feeling, your subjective symptoms, and match them with objective, measurable signs. It's this crucial link that allows your doctor to go from guessing to knowing, and to recommend the most effective treatment specifically for you.
In the end, a urodynamics test isn't just some procedure. It's a powerful tool for translation. It turns the confusing language of your symptoms into a clear story that doctors can actually read and act on. So instead of being a test to worry about, it's really a path toward clarity, toward understanding, and finally, toward a solution.